Join Niniola Williams, Managing Director of Dr. Ameyo, Stella, Adadevoh, DRASA Health Trust on Inspiration 92.3 FM, Lagos, every Wednesday at 11:30 a.m. to 12 p.m. for the DRASA Half Hour. She'll be teaching practical tips on how to stay healthy and prevent infections in our homes and communities.
Where you dey go? Sit down there, Joe. Increase your volume now. Na Inspiration FM you dey listen to. Na Inspiration FM you dey listen to.
It is your number one family radio, Inspiration 92.3 FM. Yes, time check 11:33 on the clock. You are welcome to DRASA Half Hour, a public health enlightenment program that is featured on 92.3 Inspiration FM that comes your way every Wednesday from 11:30 up until 12 p.m. Now, DRASA stands for Dr. Ameyo Stella Adadevoh, the courageous doctor who identified the first Ebola patient in Nigeria in 2014, and unfortunately she later died after contracting the infection from the parents. Such a strong and brave woman. Her actions saved the lives of millions of Nigeria. DRASA Health Trust is a non-profit public health organization established in 2015 to continue her legacy of protecting the health of Nigerians. They are constantly working to develop health champions like you and I who can identify and prevent infectious diseases and also influence those around them to do the same and stay healthy. Now, this morning with us in the studio, we have two members of the DRASA team with us, and they have come with prizes. Yay! So stay tuned for a chance to win. Our first guest is Niniola Williams. She is the managing director of DRASA Health Trust. She's a public health professional with over 10 years of experience in leading health projects, initiatives, and teams to improve the health of individuals, communities, and nations. Ladies and gentlemen, welcome to the show, Niniola Williams.
Thank you. Lovely to be here. Thank you.
Also, our second guest is a program manager at DRASA Health Trust. He's a psychologist and a public health practitioner with over 8 years of experience managing behavior change, health promotion, and prevention programs for vulnerable populations. Ladies and gentlemen, boys and girls, the city of Lagos, please welcome Christopher. Hello.
Good morning, everyone.
You're welcome.
I'm glad to be here.
All right, so great to have both of you with us in the studio this morning, and I like the fact that you guys came with prizes. So Lagos, stick around because they'll be giving out prizes in a bit. All right, so let me start with you, Niniola.
Yes.
Tell us about infectious diseases.
Thank you. Good morning, everyone. It's good to be here. I know there's so much going on in Nigeria at the moment, between the cashless policy, looking for money. We're struggling. Election is coming, but there's actually another issue going on in Nigeria that relates to infectious diseases that we wanted to speak about today. And that's an infectious disease called diphtheria, which is currently spreading around the country. We've had cases here in Lagos, also in Osun State in Southwest. And so if you haven't heard about it yet, today we'll be shedding some light on it and discussing about what we need to know as individuals to stay safe during this time. So far, we have about 14 cases in Lagos, and so it's important for us to know about it. So infectious diseases generally are caused by germs that get into our body and make us sick. And these germs can be bacteria, viruses, parasites, and different types of germs. And each type of germ causes a different disease, of course. And we know that once these things enter our bodies, they can multiply, they start spreading from person to person, they can spread through the air, through water, through the food that we eat, through the soil, through insects like mosquitoes, through animals, these kind of things. And they're so small we can't see them, but they're all around us. They live in our environment. They live all over our bodies. Imagine tabletops, the gutters and drainages in front of our homes, door handles, even the ATM stands and POS machines we're using to collect cash. They carry germs as well, right? So some of them are helpful, definitely, but many of them can be harmful and can actually cause infections for us. And so the one we want to talk about now is the one that I said was making people sick all over Nigeria. It's called diphtheria. And so far it's in 4 states. So it's in Kano, Yobe, Osun, and then here in Lagos. We've had 216 people in those 4 states getting sick with it, and unfortunately 40 of them have died. So it's quite a serious infection caused by, a bacteria that infects the parts of the body that we use to breathe and talk, our respiratory system.
Yes.
It can cause fever, which is high temperature when our bodies are hot. It can cause you to have difficulty breathing, difficulty swallowing. It can cause weakness and tiredness in our bodies, headache, cough. So generally just not feeling well, neck pains, and swelling and rashes on the skin. But the bacteria that causes it can also spread from person to person. So we see it happening where an entire home or household or family can come down with the virus.
All right, in case you're just joining us, we're live with our guests from the Dr. Ameyo, Stella, the Adadevoh Health Trust, also known as the DRASA Health Trust, Niniola Williams and Christopher Aliyu. They're here to shed more light on infectious diseases and the current outbreak of diphtheria across Lagos and Nigeria, which you may or may not be aware of. Now, they are ready to take your questions. So if you have any questions, please send us a message on WhatsApp on 0817-313-6193. The number again is 0817-313-6193. That's the number to send your WhatsApp message to. And yes, we'll take all your questions shortly. And also, they have come with prizes. So make sure you stay tuned on to your number one family radio, Inspiration 92.3 FM, for a chance to win during the quiz section of the show today. All right, Niniola, back to you.
So now, we've spoken about what this diphtheria bacteria is all about, and the question is, why should everybody care? I think we've all understood what happened with COVID-19. Even if we were not infected ourselves, we may know somebody that was. But either way, all of us were infected by the restrictions that came upon during COVID-19. Lockdown, making us wear masks, social distancing, all of those things. And so this time around, it's similar because the diphtheria bacteria can infect anyone. But the people who are most at risk are people who are living in environments that are crowded and unclean because the bacteria can be living there with them.
Yes.
So it's important for us to keep our environments clean. We also have children and adults who have not been fully vaccinated. Diphtheria is a vaccine that is given to children both when they are at 6 weeks, 10 weeks, and 14 weeks old. So if children complete those 3 doses, they should be protected as children and as adults. But we've seen that almost 88% of the people who have diphtheria now in Nigeria have not been vaccinated fully, and that's why they're now coming down with the virus or with the bacteria. So it's very important that we keep this in mind. There are many other infectious diseases that you may have heard of, common in Nigeria, across the continent of Africa, and some of them are like Ebola, meningitis, measles, tuberculosis, monkeypox, chickenpox, HIV, COVID-19. But those are some of the others.
All right, so in case you're just joining us, we're live with our guests from the Dr. Ameyo, Stella, Adadevoh, DRASA Health Trust, Niniola Williams and Christopher Aliyu, who are shedding light on infectious diseases and the current outbreak of diphtheria across Nigeria and Lagos, which you may or may not be aware of, right? So we'll soon open the lines for you to answer some quiz questions they have prepared. I hope you've been listening well, so you can answer some of these questions and win amazing prizes. Stay tuned for the quiz question. They will be taking your questions, so please send them via WhatsApp on 0817-313-6193. 0817-313-6193. Okay, Chris, over to you.
Thank you. We just spoke about how different infectious diseases are caused by different germs when they enter our body, right?
Yeah.
To know if we have an infectious disease, we're told to look out for certain signs and symptoms. And when we say signs and symptoms, what do we mean? Symptoms are indication of infectious diseases. They tell us when a germ has entered our bodies, and they come in the form of pains and discomfort that we feel in our bodies. Signs, on the other hand, are evidence of an infectious disease which a doctor, a nurse, or a health professional can see when they carry out a physical checkup or a laboratory test. Although many infectious diseases have similar symptoms, there are specific symptoms that are unique to each of these infectious diseases. Let me give us some examples of signs and symptoms. I'm sure many of us can still recall the COVID-19 pandemic. And some of the symptoms we experience are when you wake up one day and you cannot smell again, you cannot taste your food.
Serious one.
You have difficulty breathing, or you no longer feel hungry. These are symptoms of infectious, COVID-19 disease. Now, let's talk about Lassa fever, for instance. You find symptoms like bleeding in your gum, in your eyes, in your nose. And when you start vomiting, there is body weakness and there is headache. These are signs and symptoms of Lassa fever. Also, for someone with Ebola virus disease, they have symptoms like joint and muscle pain, fever, headache, diarrhea, red eyes, bleeding from their eyes, nose, and mouth. So it is important for us to pay attention to our bodies and then to seek professional help when we see or notice any of those symptoms. Now, let's talk about who are those people that are at risk of getting infected. One thing that is important for us to note here is that anyone is at risk of getting infectious diseases. But there are people that are more prone to getting infectious diseases because of their vulnerability, because of their maybe certain age group. Now, let's look at pregnant women. Because of the changes that happen during pregnancy, it changes the ability of their body to fight infections. That's one. Number two, let's talk about children, young children, because they have low immunity. So young children are also not able to fight infectious diseases like adults
can.
So, and then let's look at old people that are over the age of 60. We know that the more we age, the lesser the ability of our bodies to fight infection. So an aged person that is 60 years and above is also vulnerable to getting infectious diseases. And then let's look at people that are suffering from certain illnesses like HIV and AIDS, people that are undergoing cancer treatment, people that have certain disabilities. All these people, because of the challenges that their bodies are already trying to deal with, they are vulnerable to infectious diseases. And then other people who live in crowded and unclean environments, we know that these environments are very good harbor for germs. So those people are also prone to infectious diseases. And people living in places where they share bathroom with other people. In this case, because there are many people, germs can spread easily from one person to another. And last but not the least, healthcare workers like nurses, doctors, midwives, pharmacists, who come in contact with patients every day, because some of those patients may be sick from infectious disease, and the doctors, those caregivers may not know. So they are also vulnerable at getting infected with these diseases.
It's a lot.
Thank you.
It's a lot. Like
it is.
Because when you look at it, everybody enters. I think every single person enters one of these.
Exactly.
So you have to be very, very careful. Anyway, in case you're just joining us, you're welcome to the DRASA half-hour show, and we're live with our guests from the Dr. Ameyo, Stella, Adadevoh Health Trust, Niniola Williams and Christopher Aliyu, and they're shedding light on infectious diseases and the current outbreak of diphtheria across Lagos and Nigeria, which you may not or you may be aware of. They are ready to take your questions. So please send a WhatsApp message to 0817 313 6193. That is 0817 313 6193. I think we have a message here. Willing to take it? Should we take it?
We're ready.
Okay.
We're ready.
So this message says, "Good morning, Inspiration FM. This is Femi from Ikorodu. Hi, Femi. Just want to ask, what are the symptoms of this bacterial disease, and what age can you be vaccinated against it?" Thank you.
Wonderful. Great question, Femi from Ikorodu. Thank you for dialing or sending in that question. I think the first part of what we should understand is the symptoms of this bacterial infection we call diphtheria is very vague. You could just be having headache, coughing, feeling tired, having difficulty breathing, difficulty swallowing. So it's not very easy to diagnose it. But the reason we're here to shed awareness today is because if we have these symptoms or someone we love has these, we should get checked, please. Because now it's a time in Nigeria where this bacteria is spreading. It may not just be normal catarrh or Harmattan and all of those things. This may be something more serious. We have people who have been admitted in the infectious disease hospital here in Lagos late because they didn't know. They were at home treating malaria, treating one thing, treating another thing, not realizing that in fact it was this bacterial infection. So please, at this time, if anybody has those symptoms, your body is feeling hot, you have headache, you're feeling cold in the night, your neck is hurting you, you're having pain in your throats, please, all of those things, it's time to get checked. In terms of getting vaccinated, the vaccine is meant for children. It's meant for when we are children. There's some routine vaccinations that Nigeria will provide as a country to all of its citizens. Unfortunately, during COVID-19, many states were not able to complete those vaccinations for babies who were born simply because everything was on lockdown, everything was, a bit difficult. So that's why we're now seeing the impact of what happened in 2020 and 2021. So it's unfortunate, but it's meant for children, the vaccine, though there is an antitoxin being provided by NCDC for those who are sick. So if it is, a case of someone having it, there's a treatment available.
So you're talking about the symptoms, and I'm just, is this malaria?
It sounds like it's malaria, honestly, and that's why we have to be aware.
True,
it's very important.
Because Nigeria, like we always say, anytime we do the Wellness Wednesday show, any small thing, it's just malaria.
I'm having a bit of malaria.
Just a little bit.
Just a touch.
All right, Lagos. So we are now going to have a short quiz. Our guests will be giving prizes to the top 3 callers who answer correctly. So, and basically, we've given you expo before. So, if you are listening, you can win. You can answer these questions correctly. So, the number to call is 0700 923 923 923. The number to call is 0700 923 923 923. If you have a question, send us a WhatsApp message on 0817 313 6193. But if you are, you get mine, say you won't win our prize, call us 0700 923 923 923. All right, over to you, Nini and Chris. The first question.
Okay, so the first question we have for everyone today: can you call us and tell us 3 places where you can find germs? These bacteria, these viruses, where are they? Where do they live? Just 3 places.
Somebody have mind. Hello.
Good.
Hello. Good morning.
Good morning. What's your name and where you calling us from?
My name is Mr. Usoro. I'm calling from Igondo.
Mr. Usoro from Igondo. All right, Mr. Usoro, are you ready to answer the question?
Yes.
All right. Niniola, you want to take the question again?
Yeah. So good morning to you, sir. Can you mention 3 places where we can find germs?
Yeah, the 3 places we can find germs is number 1, where people are crowded places. Number 2, dirty environment. And number 3, we can find germs with people that are sharing the same facilities like toilet and bedroom or bathroom. Yeah.
Are we good to give? Are we good?
I think he's got it. Please, can we clap for him? Very good. I love it. He was listening very well.
Mr. Osoro, congratulations. You get mine. Please send us your name.
Yes.
Your name and your number to our WhatsApp platform 0817 313 6193. That is 0817 313 6193. Send us your name and your number, all right, so that we'll send your details to, the appropriate authorities for you to get your gifts. Moving on to the next question. All right.
Okay, our next question is, can you name 5 infectious diseases that you know?
5 infectious diseases. 0700 923 923 923. 0700 923 923 923. Hello. Hello, good morning.
Yes, good morning.
All right, what's your name and where you calling from?
I'm Shola.
Shola?
Shola.
We have measles, we have COVID-19, we have diphtheria.
Sorry, what did you say after diphtheria?
What?
You've given us 3. You said measles, COVID-19, diphtheria. We're waiting for 2 more.
No, I don't hear you properly.
You've given us 3. We need 5, so we're waiting for 2 more.
Okay, 5. Okay. Then you have
Hey, let's see if this person is 0700 923 923 923. We'll take a short word and we will be back. Stick with us, don't go anywhere.
Join Niniola Williams, Managing Director of Dr. Ameyo, Stella, Adadevoh, DRASA Health Trust on Inspiration 92.3 FM, Lagos, every Wednesday at 11:30 a.m. to 12 p.m. for the DRASA Half Hour. She'll be teaching practical tips on how to stay healthy and prevent infections in our homes and communities.
All right, we're back. 0700 923 923 923 is the number to call. 0700 923 923 923 is the number to call to win yourself a prize. This is the DRASA Wellness Half Hour Show. So make sure you stick with us and call us 0700 923 923 923 to be able to answer a question and win yourself a prize. Hello, good morning.
Hello, good morning. It's Jason FM.
Good morning. What's your name and where are you calling from?
I'm Maxwell, calling from Incorporated, Lagos.
All right.
Maxwell.
Hi, Maxwell.
Maxwell, are you ready?
Yeah.
What is it, sir?
I said, are you ready for your question?
Very well, sir.
All right.
Okay.
Take it again.
The question is, name 5 infectious diseases.
Okay, 5 infectious diseases include COVID-19, Ebola disease, HIV,
Yes.
whooping cough, and diphtheria.
Mr. Maxwell! I think Mr. Maxwell studied integrated science.
Something like that. He must have.
Mr. Maxwell, please send us your name and your number to our WhatsApp platform 0817 313 6193. 0817 313 6193. Mr. Usoro, we've seen your message. Thank you very much, Mr. Maxwell. We're waiting for your details. All right, on to the next one. 0700 923 923 923 is the number to call. 0700 923 923 923. Hey, village people. All right, let's do this. Hello.
Hello.
Hello, good morning.
Is this 92.3?
It is. You're on the right place. What's your name and where you calling from?
My name is Kemi. I'm calling from Ikeja.
Kemi from Ikeja. Kemi, are you ready for your question?
Yes, I am.
All right.
Good morning, Kemi from Ikeja. So the question we have for you today for a prize. Can you list 5 symptoms of infectious diseases? Any infectious disease symptom. 5 of them.
Okay, so 5 symptoms. Okay, so we can have body itching, vaginal discharge,
Okay.
burning urination,
Okay.
productive cough,
Okay.
that's coughing, and we can have fever.
Wow, Kemi. Please, are you a health worker? Are you a nurse? Are you a doctor? I know you're using those words. I'm wondering.
Kemi, what do you do?
I would like to put that.
We knew. Beautiful. Thank you.
Thank you very
you so
much,
much,
Kemi.
Kemi.
Can you please send your name and number to our WhatsApp platform 0817 313 6193. That is 0817 313 6193. I think we can take one more, 2 more. Let's go. Hello.
Hello. Good morning. Welcome to the show. What's your name and where are you calling from? Village people.
They are walking. 0700 923 923 923 is the number to call. Hello.
Yeah. Hello?
Sir, please turn down the volume on your radio, please.
Yes, I have.
All right. What's your name and where you calling from?
Michael from
Michael from?
Ikorodu.
Okay, Michael from Ikorodu. All right, Michael from Ikorodu. Are you ready for your question?
Yes, I am.
All right.
Okay, Michael, thanks for joining us. Can you mention 4 states where diphtheria have been confirmed in Nigeria?
4 states.
Yes.
Lagos State.
Good.
Borno State.
Go on.
Okay.
Ondo State and Kogi State.
Close. You got 50%.
But it's not correct. It's not correct. Oh my God, no. Please try again. 0700 923 923 923. 0700 923 923 923. You are so close, Michael. But alas, 0700 923 923 923 is the number to call. All right. If you've won, we're waiting for you. We're waiting for your details. All right. I think we can start rounding up. Final words.
Yeah, I think that brings us to the end of the quiz, right? We've asked our questions. So I think we just want to say a big thank you to all of us for coming and joining, learning with us this half hour. Of course, we know we'll be back next week. Once again, we are from the Dr. Ameyo, Stella, Adadevoh Health Trust. We call ourselves DRASA for short. And we're really just about building health champions, educating people and making sure that everybody knows how to stay healthy and safe. We want you to join our network of 50,000 health champions who are able to stay safe, take charge of their health, help people in their communities to do the same. Now, if you think, this is the important information to take away from today, please. If you think that you or someone around you, a loved one, maybe someone in your community, in your area is sick and you're suspecting this diphtheria bacteria we've been speaking about today, please call one of the 2 Lagos State's official reporting lines. There are 2 lines that are official reporting lines for Lagos State. The first is 0816 566 8777. That's 0816 566 8777. The second number for Lagos State's official reporting is 0816 805 7664. 0816 805 7664. And this weekend, where we have election, we're going to vote. So please, please, please make sure you wash your hands. Use your sanitizer after you go and vote. Don't go and catch any germs because you want to cast your vote, please. And also, I know all of us are hustling to get our cash, new notes, trying to exchange old notes. Remember that money carries germs too. ATM machines, POS machines, they all carry germs. So please clean your hands. Use your sanitizer, wash them with soap and water after interacting with those things. Keep your environment and your area clean and free from dirt and waste. Take your vaccinations. If you're a mother with a baby, please take them to the hospital for their routine vaccinations. You can feel free to follow us on Twitter, Instagram, and Facebook at DRASA Trust to get more information, to get those Lagos State lines so that we can report and stay safe. Our website, www.drasatrust.org, www.drasatrust.org, where you can see how to report any suspected cases or illnesses. Thank you.
All right, Lagos, that has been the DRASA half hour. They'll be back next week, Wednesday. But we will be back at 12:30 at the top of the hour as we time for the world news, 12:15. But we know is here with Sports Wakan at 12:30. We make a return on the midday rewind. Stick with us. Don't go anywhere.
It's 12 o'clock. 92.3, your number one family radio.
Always know this. Family and friends are hidden treasures. Seek them and enjoy their riches. Wanda Hope Carter.